All right, hello. I have explained so far in 8 parts the whole BIG registration process. Sorry, it is a lot. And yeah, it's just the way it is. I was talking about the clinical reasoning section of the BI test, but I quickly wrote down what I wanted to tell you about with the Valence protocols and where to look for them on a YouTube channel that I found. It's called Care Up. Now the logo looks like that. Care Up, and it's a blue logo, and it's all in Dutch, but it's all like it looks like a computer game. But they do these scenarios online about which procedures you need to follow for the BI test. And here's another list. So it's catheter insertions, man or woman, and it can be once use or indwelling. And there's 2 techniques you need to choose from: sterile technique or no touch technique. You can tell the moderator which one you have focused on the most if you do get the catheter OSCE. And then you must explain to them that you want sterile or no touch, and they work according to that protocol. Then you can get nasogastric insertion, IV insertion, and you can get subcutaneous injection as part of your medication calculation. I can't quite translate it in English, but it's the Loderecht technique, when you are like you push the patient's skin to one side, then inject it, or you pinch the patient's muscle and then inject it. It's all different techniques of how to inject. Just study those details. And maybe you'll skip some steps. No one is perfect, but as long as you maintain sterility, you'll be fine. The moderator will always say to you, you forgot to wash your hands. Sorry, you need to repeat the sorry, you don't pass the section. You need to be obviously unable to do this in order to fail, and you won't fail. As long as you practice as well. You can make up scenarios in your head. You can practice at work in the training section with the OSCE in your hand, step by step, to read in Dutch, and you must explain it all in Dutch while you're doing it. Okay, back to clinical reasoning. This book, as I mentioned, and there's also a website that I wanted to tell you about. It has all the scenarios. It has amazing scenarios that you can look for. It's called, hang on a minute, let me just try and find it. I have bookmarked it somewhere. eNurse, enurse.nl, and then you look up klinische redenering. Klinische redeneren. Klinische redeneren. Excuse my chicken scratch. There you go. eNurse klinisch redeneren. That website really helped me, and it has a red cross as a logo. You can look up different scenarios there. You can pause and think about how you would answer that scenario, and then they would give you the answer. Now, there's some things you need to remember about the clinical reasoning thing. Yes, you must use your MEWS, your modified early warning scale or score. But the other important thing is also in this book, but we've learned this since our first year, SBAR. Who remembers SBAR? You need to do this in the clinical reasoning thing as well. You need to mention to them that you will phone the doctor, introduce, like you will take the S, the situation. Hello, doctor, it's so-and-so from this department. I'm calling with regards to this patient, and this is the situation. This is the patient's symptoms. The patient was sent for so-and-so operation on this date and now is experiencing this problem. I have done the following assessment, the R in bar. The vital signs are like this, the lab results are like that, the MEWS score is this. Therefore, I think the patient is in need of assistance or in need of assessing within 1 hour. Or, yes, please, can you come in to assess the patient? Recommendation, what do you recommend that the doctor doesn't need to do or order you to do? You will repeat the vital signs, you will give the patient pain medication, you will give him stronger medication if he orders it, or you can say the patient might have an allergic reaction to a certain medication or isn't responding to the medication. Maybe we should change it. You are allowed to say things like that. The doctor will say, I agree with you. Okay, here are the following orders. Increase this, change this medication for that medication. Monitor him and let me know if the blood pressure or whatever temperature or something goes above a certain level or whatever. And yeah, and you must also read back. Read back is at the last part of the S bar. Read back and say, okay, doctor, if I understand you correctly, let me just repeat. You said this many milligrams. You must take this blood test, and I will call you back in 1 hour if it doesn't improve, that sort of thing. It all depends on what scenario you are given. And then the doctor will say, yes, that's great, cool. So you're doing a pretend thing during your clinical reasoning oral. Then what else do I think about? Yeah, it's really just a general knowledge exam. Really important. I'll try and see if any of you really want the Villans protocols. I have downloaded them, so I can send them to you via email if you want, if you've reached this stage in the BIG process already. Okay. What else? Okay, remember your algorithms. They're all in this textbook in the theory. Focus on your acronyms. Like SCEGS, there's SCEGS. I had to learn that. That's like your psychological health. There's also, I wanted to say FAST. FAST is easy though. That's your stroke algorithm, your stroke acronym. Face, arms, speech, and time. What time did the stroke start? I will admit that that can be a scenario in one of your clinical reasoning exams. It's possible. They can say the patient has the symptoms of, like, suddenly they're talking, suddenly they're not. What do you do? And you will say, FAST algorithm. I will assess the patient's face, arms, strength, speech, and I must document the time as to when it happened, the golden hour, and call 112, which is the ambulance for this country, and also explain to them the scenario. You know, you need to know what to do. And yeah, I will explain what happens after the BI test in the next video. But if you have more questions about it, let me know.